Over 1 billion Google searches per day are healthcare related. People may stumble on your website when they're looking for a provider or just when they're searching for healthcare related questions. It's great for getting this kind of traffic since it can generate new patients in the end. But none of your efforts on the internet matter if you have an outdated website. With people always visiting healthcare websites, this is often their first true impression of a practice. So your site needs to stay updated so that visitors don't view your practice as poorly managed, insecure, or old-fashioned. Hi everyone, I'm Matt Moneypenny from eTactics, and today I'm going to explain structural signs of an outdated healthcare website. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so that when we post new helpful content, you get notified. The first step that indicates an outdated website is how fast it loads. Older code makes a website more sluggish, and as technology gets faster and more complex, the code running in the background has to manage it all. 40% of consumers leave a website entirely if the page takes longer than 3 seconds to load. This is why it's so important to have updated code on your website. If not, then your website won't load as fast and users will leave before they even find what they're looking for. Design attracts users to a page and helps them stay on it longer. Old fonts and bright colored backgrounds don't help since it makes content difficult to read. Rather, a website needs to have a modern appearance. Fonts should be easy to read and formatted with headlines to separate different sections of content. Bad appearance can make it difficult to navigate a site and is enough to make anyone leave the page. It also starts with choosing a content management system, such as Squarespace or WordPress. Squarespace is a good option for those who aren't as tech savvy and can afford the more costly service. WordPress is more customizable with more themes and widgets, but requires a little bit more technology-driven mindsets. The next sign that a website is outdated is if it's not mobile friendly. In Q4 of 2019, smartphones and mobile devices accounted for 53% of all global internet traffic. They're convenient for accessing health services on the go, which means that websites need to be mobile friendly as well. If you ever need to pinch zoom in and out of your screen just to navigate where you want to go, then you know the clunkiness I'm referring to. This type of site makes it seem that your organization isn't updating on current trends. You need to run checks every so often to ensure that everything works on your website, such as links and buttons. Links that lead to unresponsive pages or error pages will negatively affect the user experience that you give and make it harder for you to rank on the first page of Google, even for your own term. Buttons also need to be dynamic because no one likes to having zoom in and out on the screen to click them, kind of like I mentioned in the last section. Words and buttons also shouldn't appear to link to something if they don't. For example, social media icons usually link back to the company's social media pages. Underlined or colored text often indicates that it will link to another page with similar information or as a source. By having fake links on your website, Google considers it malicious, will flag your page, and remove it from their database altogether. So if something looks like it will go to another web page when clicked, then it should. Another glaringly obvious sign that a website is outdated is if it's insecure. If it displays HTTPS at the very beginning of the URL, it means it's secure with a secure sockets layer or SSL certificate. This technology authenticates the identity of the site and encrypts the data sent to the server and from the server. A lock icon also displays next to the URL for these secure websites. There are so many cybersecurity risks nowadays, so a company needs this certificate to protect its users. It's required for most online businesses to have these certificates, so if a website doesn't, then it will seem antique since they aren't focusing on the user's security. The final sign I have for you is poor navigation structure. One of Google's biggest recommendations and ranking factors is user-friendliness. 88% of online users are less likely to return to a site after having a bad experience, but there are a variety of navigation styles to choose from to make it more user-friendly. Simple, modern additions can go a long way. For example, the back to the top button is a constant button at the bottom of the page that allows the users to jump back to the beginning of the page when they click it. It's much more convenient and faster than scrolling, especially for longer pages. Navigation bars can also give you a huge boost if you choose the right kind. There are a few display options such as vertical, sticky, and mega menus. Vertical menus display on the side of the page so as users scroll, they can still access their options. Sticky menus lock in place as the user scrolls, so again, they always have easy access to other pages. Now, mega menus are good for breaking up a lot of content into lists so that it all displays the information at the same time. With people using the internet so much to look up health information, they're likely going to stumble upon your website at some point or another. This is often their very first impression of your practice, so you want it to be meaningful. If your site is outdated, it can be hard to convince them that your practice is well managed, secure, and modern. Paying attention to these signs will help keep your website up to date so users will stay on your website longer and be more inclined to choose you as their practice. If you'd like to learn more about outdated healthcare websites, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below. Well, what are you waiting for? Subscribe to our YouTube channel.